I'd like now to throw out a first question to our panel. It's for the round table, and I'd like to turn particularly to the other participants, but not only of them. I'm thinking Mr. Laget's President of FEE. My question also more specifically directed to Mr. Delmotte, President of FESASS, and also to Mr. Bem, President of IFAH Europe, and also the question is more precisely directed to Mr. Iguero, Vice President of copa-cogeca. What about the proper use of antibiotics in the future at the farm level? What do you think about this? We are redesigning our legislation, rethinking it. That's part of this question. It underlies my question. How do you think we should deal with this issue? How do you think the legislation should contribute or make sure that we can much improve our use of antibiotics and medicines in this particular context? Who would like to answer first of all? Please go ahead. Mr. Lagens. Well, we agree actually about this. The legislation is terribly important. The systems for visiting is very important in ensuring prevention policies are effective. This is an important policy tool which we must use.
The visitation system to have the prevention in the use of antimicrobial, and then to work with farmers is very important to change and to continue in the changing and to deepen in the paradigm of prevention is better than cure. And for that, we need some tools. And the visitation system of the legislation, animal health, is a real tool, but that must be feasible and effective, also economically. And it's very important. Other important tool that we discussed this morning, and the Parliament is taking in consideration also, a real prescription. A real veterinarian prescription is a very important tool to have exact control of the medication, of the medicines, the use of medicines. Transparency is very important, transparency of the market of medicines, and for us it's very important the concerns about the sale online, the sale in internet, because we don't achieve any goal with controlling everything, but we leave any window or any door to selling any kind of medicine, including antibiotics, in any way. And we need more discussion about the critical antibiotics. I think the antibiotics, we need the antibiotics. We are talking about prudent use of antibiotics. We are not talking about banning antibiotics for humans and for animals. I think we need to discuss, and we need science evidence to take decisions about to ban any kind of antibiotics in animals. We need scientific evidence, and we need more survey and research. Then that is my first intervention at the moment.
Merci, Monsieur Lagens.
Thank you, Mr. Lagens. Well, would anybody like to respond to that? Maybe Mr. Delmotte?
La réponse à la...
Yes, well, the answer to that question, maybe I can answer with a question. Why? Well, we need to wait for this new regulation. It needs to offer added value. It shouldn't just be seen as an additional problem, as an additional burden on the sector. Why? Well, quite simply because despite what we heard this morning, despite all of these good biosecurity measures, good precautionary measures, good management, we won't be able to prevent bacteria or diseases. So we're going to need these antibiotics. We always will. And then, of course, there are going to be diseases that we won't be able to deal with. And then we need to think about the future. Well, decisions need to be taken. We need to think about alternative solutions as well. I think several speakers mentioned about new molecules, but that's not necessarily ready. Then I think we've talked about vaccinations and other alternatives. So there are some alternatives that may offer solutions. So we can sometimes do things differently, do something differently instead of using antibiotics. But you need to think about what's happening. You need to think about animal welfare. You need to think about the product and so on. So we need to make sure that things are implemented in the right order, not the wrong way round. Well, there's one thing I'm concerned about as well. We talked about the lifespan of the antibiotic and how it is effective. Now, this is something that I have been thinking about a lot. Well, what antibiotics will my vet still have tomorrow? I think that we can plan, and for some specific molecules and very sensitive molecules, we will have to carry out tests in advance to decide whether or not to use the antibiotic. So I think that in our sector we have been open to technological development. Innovations have been implemented, and so that's just what I'd have to say in a few words about this sector. Thank you very much for that comment. Would anybody else like to take the floor?
Yes, maybe from my side. First, I want to thank the organizers of today's conference for the invitation and to giving the industry as well the chance to participate here in the roundtable discussion. Yes, coming to your question, maybe some words first about Alpha Europe. Alpha Europe represents the animal health manufacturers in Europe, the medicine manufacturers in Europe. This is a highly innovative industry, investing around about €500 million per year into R&D, providing around about 50,000 jobs in Europe. And I want to say we firmly believe that good animal health is a cornerstone of high welfare standards for all animals. Our products, which have included antibiotics since 1940s roundabout, have brought significant improvements in animal health and welfare over the year. Speaking about antibiotics in particular, I think we have provided veterinarians and animal owners with a means to treat before not manageable conditions. The benefits for animals and animal welfare, I think, are clear. Additionally, our ability to protect the health of animals means we also protect human health by reducing the risk of transmission of a number of zoonotic diseases. I think that's a bit like One Health in action. So what I said, the animal health industry is strongly committed to the health of animals and to the health of the public. Our main responsibility regarding antibiotics, I would say it's to secure the continued availability of antibiotics as effective, safe and high quality products so veterinarians can treat different bacterial diseases in different animal species. At the same time, we meet high-level standards regarding product production, minimizing risks to animals and to people, and of course also to the environment arising from the use. So the range of different antibiotics, we heard that today several times already, but the range of antibiotics for veterinary use is much smaller than the antibiotics for human use. In addition comes that the last new antibiotic class was approved for veterinary use around about 25 years ago. So that's quite a while, and we heard that from Mr. van Dijk today as well. So nothing new has been developed since, and the OIE regularly publishes a list of critical products, critical for animal use. And we think that any actions to further restrict the availability of the existing antibiotics will severely impact animal health and welfare. So I think that is a very important thing to mention here. And as there are no real alternatives to antibiotics for many diseases, the animal health industry mainly needs to focus on making improvements on the existing antibiotics, but I will come back to that in the frame of the second question. Thank you.
Merci pour cette intervention de l'IFA.
Thank you very much for those comments from IFA. Anybody else?
Thank you. Thank you very much, Mr. Chairman, and thank you also very much for inviting copa-cogeca to this meeting. Regarding your question, copa-cogeca considers that everyone must play their role in controlling and reducing antimicrobial resistance in Europe. It is clear a One Health concern affecting both animals and humans. European farmers and agri-cooperatives are keen to contribute, playing their role in tackling antimicrobial resistance at farm level. And in this respect, although a very high level of competence is required for farmers to be able to detect possible infections, veterinarians remain the competent person to make the diagnosis. At the respective level, both farmers and veterinarians have a key role to play in the management of animal disease and farm level. It is in farmer interest to ensure sustainable livestock production with healthy and productive animals. We know that improving animal health is one of the best ways to reduce the need for antibiotic treatment. Good hygiene, proper feed, and appropriate environment for animals and good management are already at the top of our agenda. However, animals can still become ill, and appropriate therapy and veterinary medicine should be available in all European state members and all species, including minor species and minor uses, with face for the time being a substantial lack of veterinarian medicine. Also, the future regulation can improve this situation, but we have to be prudent and be too optimistic. As copa-cogeca, we see some positive aspects like the adherence to the prescription, which we fully support, and the improvement data collection system and the prohibition of the routine use of antibiotics in prophylaxis. However, this debate goes beyond the relation farmer and veterinarian. In our opinion, it is vital to strike a balance between innovation and new antibiotics, the availability of this veterinary medicine in all member states, all the species and all the conditions, and the affordability of these medicines. Of course, we also have to think about what is the resistance in the antibiotics that is a serious concern in Europe and worldwide. Possible measures to control this problem are currently under discussion in all relevant international forums. So the debate confirms the need of scientific discussion as well as the importance of the objective communication throughout the food chains and including the consumers. Thank you.
Merci pour cette...
Thank you very much for that comment. Is there anybody else? Any more comments? Apparently not, so then maybe I can ask a question. As we heard this morning from the OIE, this is not only an EU issue, it's also an international issue. Now, we are currently implementing a European regulation. So, what sort of international cooperation do you think can be implemented to tackle this challenge? What sort of cooperation can we implement with international bodies to achieve our aims, not only at European level, but at international level? Commissioner, would you like to answer?
Okay, it's very important. You know, I would like to say that only one way to close cooperation together with WHO, with Animal World Health Organization, with Food and Agriculture Organization, with OECD, of course encouraging such formations like Transatlantic Task Force on Antimicrobial Resistance, and there are possibilities to cooperate on the regional level, and European level. You know, we have WHO European Regional Bureau. I have good possibility to sign memorandum of understanding, speaking about how to follow global action plan, European action plan, how to encourage national action plans, and to combine forces and create some coordinating mechanisms. I am ready to follow such task and to discuss with those organizations together, preparing coordinating action plan in my mandate until 2019. Of course, as you know, we see a good opportunity to collaborate with China, with India, raising questions about antimicrobial resistance and about their possibility to support our actions and to create bridges between us. Thank you.
Merci beaucoup pour cette
Sorry, I would like to mention also G7. G7 today is very powerful instrument.
Merci beaucoup.
Thank you very much. Would anybody else like to comment on that point, Mr. Leggins?
Yes, sorry for I changed. Yes, the Federation is very interested in this international aspect because the Federation of Veterinarians of Europe is very important in this challenge, in this global issue, because antimicrobial resistance is a real global challenge. And we can do something to help that. We have close cooperation with the American Veterinary Medical Association and the Canadian Veterinary Association, and we have some close contact and periodical contact, and one of the topics we have on the table is that. And I can mention also that FVE is not only composed for members of the European Union, we have members for countries outside the European Union. We are having this topic in the debate, and we have close. Some of our members, and even the FVE, is member of the World Veterinary Association, and we have this topic on the table of the World Veterinary Association. That means that we as professional association, we have this topic on our table, and we try to share this topic with the rest of professional associations all over the world. That is our contribution.
Merci beaucoup à la Fédération vétérinaire.
Thank you very much to the Federation of Vets. I'll give the floor now to the Minister for Agriculture.
Merci bien.
Thank you very much. Well, as the Minister for Agriculture, I'm also responsible for monitoring the economic situation for agriculture at the national level and for implementing community legislation. There's a lot of feedback from the speaker's headphones in the microphone. It's hard to hear him. We look at cooperation with the third countries, the Commission, WHS and the OIE. We also look at addressing AMR issues, and we propose support to try and tackle that. Thank you very much, Minister. I'll give the floor to Mr. Petitot, who would like to take the floor.
Oui, simplement pour...
Yes, well, I just want to say that in her draft report, Mrs. Grosstedt has tabled an amendment which suggests introducing a reciprocity clause. Now, this would allow the EU, when it imports foodstuffs, to look at the compliance with standards to tackle AMR. Now, this is perhaps something that's difficult to implement in practice, but I do think it is sending out a very important message here. And the members of Parliament have also tabled some amendments which aim to encourage better international cooperation. They're calling for a strategy to tackle AMR and to work with the WHO in particular, as the Commissioner just mentioned. Now, this is very important because AMR, of course, does not stop at the EU's borders.
Merci beaucoup.
Thank you very much. Now, we have some requests from the floor, and so I would just like to ask you to introduce yourself briefly before you ask your question.
Monsieur le Président.
Thank you very much, Chairman. Olivier Debar. I work in the French Agriculture Ministry, and I'm responsible, amongst other things, for the national plan to reduce AMR risks in veterinary medicine. And we have the Eco-Bio plan in France. Now, I'd like to start by thanking you for having organised this meeting. It allows vets and farmers to share their experience and to talk about successful efforts to tackle AMR. Now, this chance for vets and farmers to speak out is very, very important. We are all convinced and we all believe that farmers and vets are part of the solution. But sometimes people think the opposite. You read out an article from a newspaper earlier, and it does show that there is the risk that some readers who are not well informed might see antibiotics or the use of antibiotics as problematic. But we here, as well-informed readers, see the problem as being the abuse of antibiotics, not the use of antibiotics. So it's important to mention that here in this room we do all believe that the problem is the abuse of antibiotics, but many people outside the room believe it's the use of antibiotics on animals is the problem. So it's important to make sure that that message is clear. And then I'd also like to thank you for having organised this meeting, because it gives us a chance to think about two key points here. We need to think about the lessons learned and what the future holds. So it's important for us to talk about a lesson learned and something for the future. The lesson I'd like to share is that this morning we've seen that farmers haven't waited for a framework before they've taken voluntary initiatives. You can see that the profession itself has taken steps to reduce the use of antibiotics, and they are therefore following the guidelines issued by international bodies which suggest that we need to reduce the use of antibiotics. And then I'd also like to add that it's very important that the competent authorities, and I'm from one of those authorities, also take measures in terms of legislation and rules for the future. And these rules should be ones which allow farmers to continue reasonable use of antibiotics. This is very, very important. In France, we're seeing that the results are showing we're heading in the right direction. And we do need commitment and involvement from farmers and vets. And what I'd like to say here is that when we, as an authority, take restrictive measures, well, they need to be balanced to make sure that we don't lose the dynamic of the process. The farmers are making an effort. Efforts do need to be continued, and we do need to make sure that we have regulations to make sure that the rules are applied, but we need to remember that we want to have cautious use of antibiotics, and they should just be used when necessary. And then, to make things more practical, I would say that when we're discussing this draft regulation on medicated feed and veterinary medicines, that we want to express one desire. We want the measures that we're going to take in Europe to be measures that will also be applied to animal products which come from third countries and which will be imported into the EU. So, for a European consumer, it would not make sense if the level of quality and safety is different for products that come outside the EU. So consumers need to have the same guaranteed level for their products. So that's why we think that the requirements or the obligations, we could say, which are placed on our producers, also apply to animals and food which is imported into the EU. So this means that we do face some legal challenges here because the text is not an easy one to work with. And I do want to say that this does need to agree with SPS regulations and WTO regulations. So, as for the lessons learned, well, if we're going to make sure that vets and farmers are as active in the future, we need to make sure that the competent authorities include the same sort of approach in the rules that are going to be proposed. So we need to make sure that the dynamic is maintained and to make sure that farmers and vets are involved, because they shouldn't be the only ones to bear the burden. And then there's another thing when we're thinking about the future. The future. We're talking about antibiotics. And you know that FAO, WHO, OIE, GSET, you know that there are various guidelines. And these can be very precise guidelines. And they list the measures that need to be implemented. Well, when we're thinking about the future here, it may be the case that in several years' time, we will be meeting to discuss other substances in addition to antibiotics. For example, things to deal with parasites. So, it would be good if access to anti-parasite medications and so on isn't as easy.
Je vous demande juste de venir au bout parce qu'il y a encore d'autres...
Sorry, could I just ask you to conclude, because we do have some other requests for the floor, so I'd just like to ask you to conclude your comment.
Je conclus avec...
I would just conclude with one request, the same I made for imports. I'd like to ask partners in the competent authorities that when they're involved in negotiations on other products, that they should support the ban of sales on the internet for products that need to be given by prescription. This should not only apply to antibiotics, because in the future this could concern other substances, for example, medication against parasites. And so, if we don't aim to cover those, perhaps we won't be ambitious enough. Internet sales, well, maybe it's a bit too free at the moment. Yes, the internet is good for many things, but whenever it comes to health products, I think it's very dangerous. Or at least in France, we think it's very dangerous to have such easy access to a medication which should actually be sold under prescription. And the internet is a modern tool. There is the international aspect to it, but for health products which need to be given on prescription, I think the internet is going too far here. The internet is something that's not controlled. And the ban is apply in the legislation in the country where the product's being bought. I'll give the floor to Mr. Fitchin, who has something to add.
Grazie, Presidente.
Thank you very much, Chairman. I'm Mr. Facelli. I work for the Italian Health Ministry. The Health Minister in Italy covers two areas, animal health and human health. I cover animal health. Our ministry is working hard on this issue, and a series of initiatives have been taken, but I don't want to give you the details on those now. I just want to mention one in particular which I think is particularly important, namely the fact that there is the use of electronic prescriptions for animal prescriptions, and this is used in 3 regions out of 21 in Italy. It's used on a voluntary basis, but I think it's very, very important for us to be able to have an idea of what the prescriptions issued are. Now, there is one thing that we are concerned about, and this is concerned the 2 regulations which are currently being discussed, one on medicated feed and the other on veterinary medicines. The prescription of veterinary medicines can also be given by non-vets. Now, this could actually work against efforts to achieve reasonable use of antibiotics, because somebody might not have the right professional background, but they're being given the possibility and authority to issue these prescriptions. So that's something I want to raise with the Commissioner. This is something that we are concerned about. Thank you.
Merci beaucoup.
Thank you very much, Dr. Facelli. I'll give the floor to Mr. Igera.
Thank you very much, Chairman. I would like also to add some comments about the international aspect, because for us as farmers, we are working in a global market, and also is very worried for us. For this reason, I think that the collaboration between the institutions, the FEA, Commission, the Parliament, with third countries is very, very important to try to promote the same legislation that we are trying to face. Information, training, also is the things that we have together. We have to work together with the third countries. European Union now in the antimicrobial resistance is go further. Is try to be ahead, leading this question, this problem, and we are going to have another time a different product. For this reason, I would like also to repeat some of the things that previous interventions have said, that we need the reciprocity. We have to be sure that all the products that we import in European Union comply with the European Union legislation. That is what our consumers are demanding us. So we have to be sure that all our products that we import comply with our legislation. But also I would like to be further. Why? Because also we are exporters. We put our products, our annual products in third countries, and we have to promote our production. We have an European production system that is in the top of the world, and we have to promote our products, to know that in the third countries that our products are the best in all the world. Not only the quality, if not also in the system that we produce our animals. So for this reason, for us, and this something that from the copa-cogeca is demanding for the Commission, we need to help to promote our product in third countries to be sure that these different products have the real value in the market. Thank you.
Merci beaucoup. Suite à l'intervention de la délégation.
Thanks. Thanks so much, Italy, for raising a good question as well. The turn goes to the Department of Medicinal Products or Medical Expertise on behalf of the Commission. Can we hear some of your contributions and thoughts, you being, of course, great experts in the area?
Thank you, Mr. Chairman. I mean, a general comment, since a lot of reference has been made to the ongoing revision of the current legislation in the veterinary medicines. There were a lot of comments, so many I can comment on some of them. The intention currently in the proposal about the limitations who can prescribe the veterinary medicines takes into account the differences in member states in this regard. But it's not the intention of the proposal as such to regulate the profession. It is more to regulate the authorization, distribution and use of medicines. Of course, all these things are under discussion. Now the discussions are ongoing in the Parliament and in the Council. But let's say we believe that the Member States are best placed to regulate the professions in this regard. So there were many comments from France, if I understood well. For example, the online medicines, the online possibility to purchase medicines online. This is already ongoing in some countries. It was modeled based on the experience from the human side. Member states will always have the possibility to restrict this kind of practice if they will consider it necessary or appropriate. So currently it's as well as all the other provisions being under discussion under the legislative procedure. Maybe my colleague also.
Et peut-être juste un point pour...
Well, just very briefly, a number of interesting points made throughout this discussion regarding the reciprocity clause. The Commission, of course, is open-minded about all the different arguments during our discussion, but the Commission also has to take account of impact on trade, on business. In the WTO, of course, these are important considerations. We hear what various people are saying. A number of member states in particular are very concerned with this. There's a Parliament amendment as well along these lines. But any decision, when taken, will be preceded by an examination of business impacts, trade impacts. We know this from the past. Massive financial ramifications for Europe, and this can be very negative. So please understand this. It's not exactly straightforward. We're talking about global approaches, comprehensive approaches here. We're talking about comprehensive activities or actions or understandings in order to be intelligent and effective. We accept the idea of being, to some extent, a leader. We don't impose standards on anybody else, though. We don't impose standards on third countries or have them imposed on us. And as I say, this type of thing can lead to unfortunate and unpredicted ramifications. So that's what we'd like to say there on behalf of the Commission. Thanks very much indeed. I'd like now to give the floor back to Mr. Lagan.
The Italian delegations is a very important thing, prescription, because we are talking about controlling, and without this tool, we don't have anything. And of course, the intention of the Commission is very clear, but the wording of the law must be very clear. We can give any door, any window to not controlling this important issue, antimicrobial resistance. And I agree, that I know there are differences in some countries. I know, we have been discussing during the lunch, but these models, we must respect this model, but not imposing to other countries. That could be difficult. Then it's a very important topic, and I agree with the position of the Parliament, as Monsieur Petitot have said before. I think I completely agree with the representative of the citizens of Europe.
Merci beaucoup.
Well, thanks. Thank you very much indeed. Any more comments, please, on our side of the table or indeed on the other? Can I look to the floor, maybe? Please, yes, go ahead. I will indeed, thanks. Please, go ahead over there, to my right.
Thank you. I'm Taina Aaltonen, the CVO from Finland, and I would like to take the opportunity to pass forward the message and appeal from the farmers' organizations from the Nordic countries, which they have originally sent to the Nordic Ministers of Health, Food and Agriculture, and also to the Nordic Council. And here in their appeal, they want to raise up a matter related to these two legislative proposals on veterinary medicinal products and medicated feed. And their major concern in this field is that these proposals still allow the prophylactic use of antibiotics, which mean that it is still allowed to treat groups of animals with no diagnosis or no clinical signs of disease. And they want to raise up the information that the prophylactic use of antibiotics is not allowed in the Nordic countries, and it has been seen as one of the most important tools to secure the responsible use of antibiotics. And you can see also from the published annual report describing the usage of antimicrobials in animal husbandry that there are great differences between countries. And in Nordic countries, the amount of antimicrobials used is very low, and one major reason here is the situation that we don't use antibiotics as a prophylactic measure and try to focus on other measures. But so they really strongly urge not only the minister but also the Commission to take this on board here. Thank you.
Merci beaucoup.
Thanks. Any further comments or questions? If not, then thanks very much indeed. I'm not going to adjourn just yet this part of the roundtable. I'd like to turn to the Commissioner. Commissioner, would you like to conclude this particular session? Thank you.
Thank you. Thank you very much indeed. I listened very carefully, especially those remarks about prophylactic use of antibiotics. You know, I'm a medical doctor. I fully agree with you, personally. We agree it's very, very dangerous. If it's, frankly speaking, unacceptable, from my point of view, personally. Because I know what does it mean if you all raise question about antimicrobial resistance on one hand. On the other hand, you can raise question about use of antibiotics in prophylactics. What does it mean? Of course, vaccines is real instrument. Vaccines. Of course, speaking about zoonosis, it's really, of course, you know, especially when you are not needed antibiotics, but antibiotics in prophylactics. Something very controversial. And we must raise those questions between all of us, in member states, with operators, and asking all of us. It's proper way. Because bearing in mind such huge challenge around the world on antimicrobial resistance, how bacteria are more flexible to use your antibiotics in their life cycle. That's absolutely, of course, speaking about online sailing, online control. Of course, countries are different, of course, I know. But today, those pieces of legislation is in the hands of Council and European Parliament. Commission must be honest broker, and you must keep on board all your intentions and see which way is more fruitful. But we're ready to see how it will be in debates in Council and from Parliament side. Of course, we are open-minded, but frankly speaking, of course, we must bear in mind that the main goal is antimicrobial resistance. We must keep eyes on such issue. Okay, thank you very much indeed. Of course, some questions were clearly responded for center side, and for my point of view, I am ready to do my best and to be very active on such topics all my 4 years, and we are ready to communicate with all operators. It will be very nice to create some common group inviting all actors, not only farmers and veterinarians, but hospitals, medical society, public health specialists, of course, those who produce medicated feeds, because it's also very interesting to see technologies and environmental issues around us. I am ready to organize such group and such debates and see how to move forward related to stopping antimicrobial resistance and reducing death in Europe. Every year, 25, 27, 29,000 deaths of people every year because of antimicrobial resistance. But it's common idea, common message. We must understand the situation. They are consumers, but they are today death. It's our responsibility to see how to solve those issues, those questions.
Merci beaucoup, Monsieur le Commissaire.
Well, thank you, Commissioner. Thank you for being so committed. And I'm convinced that together with the European Parliament, the Commission will certainly tackle this head on, take the bull by the horns, so that we can really face a future where we manage antibiotics and the antimicrobial resistance question, dealing with scourge so much more effectively. We're convinced of that. Thank you very much indeed, Commissioner, and everybody. Thank you to you all.